I wanted to become a pediatrician when I was 5 years old. My parents told me, if you're going to be a doctor, be a plastic surgeon, make a lot of money. I used to fight with them. I think the reason I wanted to be a pediatrician is my dad was on the road, took me 2 hours to get home to his office. My mother was a very nervous mother to the point where we were going to our pediatrician's office once or twice a day. And the pediatrician finally said to her, Mrs. Lander, I'll stop at your house every day on my way home. This is what I wanted to do. I'm lucky that I've been able to do it. Not all of us can do what we'd like to do for our lives. And for me, it's terrific. I'm very happy I've been able to do this.
Did you have any families that you stopped by on your way to work?
Did I?
Yeah.
Listen, I'm old enough.
As a pediatrician.
I did house calls in the early days. I mean, I started practicing back in the 70s. So yes, I would do house calls.
So let's reminisce a little bit. What kind of setting did you practice in, and how's the landscape change today?
Sure. So when I started practicing, I'm from New Jersey. It was a upper middle class to rich area. I started practicing and I found out what everyone else was charging, and I decided I'm going to charge $2 more. So a sick visit was $18 back in 1978. And back then it was just word of mouth. I was always available. I tried to be nice to my patients. If I was covering someone, I would never take one of their patients. But word spread and my practice built. Back then there was no CPT coding. You just charged to visit, the patient paid you, and then you submit insurance forms to them to get paid back. Obviously things started changing once the CPT came out, which affected us probably in the late 80s, and everything changed. The insurance company became the middleman, and they were taking money out of our pockets. They were doing nothing but offering insurance to the patients, their clients. So I've not been happy with the world of insurance.
Yeah.
So when you say you took $18, or was like 85% of your payments in cash?
Cash and checks. People weren't using credit cards back then. So a visit was $18. I think I charged $2 for a polio, $2 for a DPT. It was a combination, check, cash, but no credit cards, no chickens either. This is suburbia.
Yeah.
And was it, because I'm always reminded of Joe Serlo. He said he grew up somewhere in the East Coast. He's a surgeon and then an ER doctor. And he said that in the community where he grew up is a very Italian community. And the family doctor did house calls. He said by the fourth house call, the cops had to take him home because at every stop at night, the lady of the house wanted him to have a glass of wine or some sort of Was that your experience when you started first too, that you had to take like a meal or a dessert or a glass of wine or something to the family would just wanted to treat you for something like that, or no?
It wasn't that, and I was never a drinker. Thank you very much for coming, Dr. Lander, was all I needed. We did have someone in our community who, older than I was, making house calls for many years, and he was famously known for jumping out of the window when the husbands would come home. Things changed. Obviously, it's better to have the patient in the office. I would run to my office 10 o'clock at night back in the 80s and 90s. If somebody was sick and I thought I might need to give them a nebulizer or I wanted to do a strep test, I was running back to the office at nighttime to see my patients as well. It made more sense.
How was the record keeping progress notes back then?
Oh, they were great. For someone like me who has a horrible handwriting, I can't decipher my notes from almost 50 years ago. Very minimal. Yeah, you saw somebody that had an ear infection. Your notes were the date, LOM, antibiotic. It was terrible. It was terrible. Yeah. And certainly that changed very quickly as I realized I'm not going to remember everything I did with the patient. You have to more complete notes. And before using EMRs, I had templates for my paper charts. So which would help me see patients a little bit faster, but still know that I covered all bases, be it in part of your history or the physical exam.
Yeah, I remember when we took over one of the practices of a senior physician back in 2003, we were cleaning out some of the charts and I would find these records that had that yellow piece of paper with about 40 visits on it, like a
Yep.
lunch paper, LOM Amoxil. And that was the visit. And then a little scribble of $5, $10, however the office visit was. That has, over time, gotten a little bit more complicated. What are your thoughts on billing, record keeping, how the process has become more complicated with the advent of computers? Is it a good thing or is it a bad thing?